Hello again. I'm Sami Mansfield, founder of Cancer Wellness for Life. Thanks so much for having me back to the MedSynapse team. Dr. Nigar, it's so great to see you. So last time we discussed exercise oncology in a general format, and here we are in October. It is Breast Cancer Awareness Month. I don't know if everybody realizes this, but we know that breast cancer is the most commonly diagnosed cancer in the world. More than 2.3 million women and many men, only about 5% of these numbers, will be diagnosed with breast cancer this year. So, question from Dr. Nigar will be, last time we discussed the broad exercise recommendations for individuals who've been diagnosed with cancer. Since it is currently Breast Cancer Awareness Month, could you provide any specific insight for doctors working with breast cancer patients or survivors, or are the recommendations different? So I think that's a really important question and answer. So in general, we know that from the American College of so I think that's a really great question. And in simplistic terms, we do not need to recommend different exercise for individuals with breast cancer. I think the biggest piece is understanding if they have specific treatment-related side effects or other post-surgical limitations that may come from breast cancer. As an example, if they are at risk of lymphedema because they've had many lymph nodes removed and they might have other comorbidities, we want to maybe take a more structured and maybe a slower ramp up to resistance training. But we don't want to forget resistance training in breast cancer because we know that actually strengthening reduces the risk of lymphedema and reduces the risk of a lot of the other comorbidities related to breast cancer. So I think it's really important to note that anyone working with someone with breast cancer from the day of diagnosis should encourage that individual to start to strive to meet these exercise recommendations. Really critical in managing and reducing a lot of the treatment-related side effects, such as chemo brain or fatigue or weight gain. The most important thing is to take into consideration post-surgical limitations, maybe that time point of 4 to 6 weeks off, and then ramping up slowly, especially if someone is at higher risk of lymphedema. So the second question we want to talk about today is there any specific research on exercise and breast cancer outcomes? Actually, I'm really excited about this question about exercise and breast cancer outcomes because for years we would say to people, oh, exercise is great, you should just exercise. But now we actually know that specifically in breast cancer, the research on exercise has shown that not only does exercise improve overall survival, it improves a lot of, like I said, a lot of the side effects that so many of our breast cancer patients actually manage. We're starting to understand that for individuals living with bone metastasis, from a primary breast cancer now into a secondary disease and metastatic disease, that exercise is really beneficial into managing not only the fatigue, but also the functional limitations that can come. Early research done more on the prostate side, but being applied to breast understands that by loading these bones, we can actually create new bone growth, therefore potentially slowing down or reducing the likelihood of a break. But I think the most important thing to understand is if you have a diagnosis of breast cancer, you should exercise because you are doing something to improve your survival. And I think the last question, is there any new evidence about exercise and breast cancer that I'm excited about? For 20 years of my career, we really had a lot of research just saying, exercise is good, you should strive to meet recommendations, but we didn't really have a lot of A, prescription of how much exercise should you do with breast cancer, but B, really understanding, is it overall survival or what does that really the detail look like? Like, what does survival mean for breast cancer? And then how does that really relate to the types of breast cancer? So recently, just this last year, and we can put this in the show notes, we had a research study that looked at exercise and what we know as progression-free survival. So yes, we can reduce recurrence, but we also understand that the likelihood of progression is now diminished simply by engaging in an exercise program. So not only do you have less fatigue, less sleep disturbance, less hormonal changes, less chemo brain, less depression, less anxiety, you now are improving your progression-free survival and overall survival. So I would definitely say that anyone with a diagnosis of breast cancer should exercise. I think that we need to reiterate the importance of strengthening. If you're on any restrictions with your upper body, maybe post-surgical, then work on your lower body. It is totally okay to do body weight. Start with strengthening, start getting your walking or aerobic exercise in, but don't forget your strengthening. It's really beneficial, especially with women with breast cancer and hormonal changes. Thank you so much for having me. Thank you for raising the awareness of breast cancer during Breast Cancer Awareness Month. Hope everybody has a great day.